Good evening. Thanks for joining us for this Facebook Live today. And I'm very, very excited today because this is a subject I'm very passionate about, women's health and well-being. And with me, I have a women's health expert and a holistic practitioner, a gynecologist, Dr. Laura Gotz. So thank you, Laura, for joining me. And I feel really privileged and honored that you have joined me online actually you are from Cologne in Germany, so this is the beauty of the online world. We can make friendships, build relationships, and share our knowledge on online platforms. So I'm very, very grateful for you to take the time to join us. And I know there are many women who were really looking forward for this today, because when we had to postpone a couple of weeks ago, I had received some messages asking me what's happening. And unfortunately, sometimes we plan, but we have to adjust our plans, and that's what happened. And thanks for rescheduling with me, Laura. So thanks and welcome. I would like to introduce Laura first of all. Dr. Laura Gotz is a gynecologist and holistic practitioner, and she's very passionate about integrating alternative mental health practices in modern medical treatment in Western medicine, which is brilliant. That's why I got attracted to her, I have to admit. She is the founder of This Is Your Potential, an online company which offers services such as psychosomatic counseling, birthing courses, and stress management programs. So she helps her clients resolve issues such as low self-confidence, fears, anxiety, including pregnancy anxiety. We know about that for those who have been pregnant, and fear of birth. It's very, very common as well. Inner conflict, limiting beliefs, depression, chronic and psychosomatic pain. And I'm very, very curious about this subject of psychosomatic pain, how it helps us to reconnect with our body as women. So I'm very, very, very curious for today. So she has been recently awarded Exceptional Woman Award by Global Women Club during last summit in July in the Global Women Club Global Summit. So well done. I've seen you receiving the award, and I can say it's well deserved, because you're doing so much work for women's health in general, and you are so inspirational to hear you speaking. So thanks and welcome once again, Laura. And I'd like to start by asking you, first of all, to tell us a bit more how you have integrated modern medicine with alternative holistic approaches. Your why to this. Why have you done this?
Thank you very much for your introduction, Catherine. That was so much text right there, and I was like, oh my God, how many things I'm doing, and all of the women that are looking, I hope they can find something that is for them interesting, because I want to help women in all aspects of lives. This is what I want to do as a transformational coach, apart from being a gynecologist. And I want to start by telling the people who are watching that I want this to be a friendly discussion. I just want to share from my experience as a gynecologist, as a coach, as an author, on women's health, so we can all learn, because I'm learning every time from you, Catherine, from every live video. And I'm encouraging people to post questions if they want to know more, or if there's something that we can do right now live, because I know you're also a coach, so I would like to make it more interactive. You asked me what is my why am I doing all of this, and we all know as coaches that this is a huge question. That is, when you're asking somebody why are you doing something, the first response is not going to be the right one, because when you ask somebody why are you into medicine, people are going to say, I want to help people. And that's exactly what I want. I want to help women in all stages of life. That's why I became a gynecologist. But then when I did this transition with psychosomatic and mental health and coaching, then I realized that there's more why to me. And actually my why just brought me to tears when I realized why I was doing this, why I was helping women. And I will start with a little story from the beginning of my residency. I am sure that people want to know what are doctors like when they're starting out as doctors. So, you start and you think you're going to be Dr. House, not Grey's Anatomy, not so much love, but, you're going to do a lot of diagnostics. And then you get your first patients. And they don't come with serious illnesses. There's no Dr. House moment, especially with women when they came and they had pain. I had one who came at night and she said she has pain. And I asked her, did you take ibuprofen for this pain? I wanted to see if it helped. And she looked at me and she said, I don't believe in modern medicine. So that was, for me, okay. So she's not going to be the only one who is not coming to the doctor for a pill. She's going to come for something else. And then other patients came. And I had also these very weird realizations that what I've learned in school wasn't really the same as it's going to be in the practice. One woman came at 2 a.m. So when your doctors usually sleep, hopefully, where there's no drama. And she said she has pain. That's why she got there. And when I saw her, she told me, actually, I don't have any pain bodily. I just fought with my boyfriend and I am so stressed out, I don't know where to go. And it was for me as a surgeon, the gynecologists are surgeon, that somebody is coming in the middle of the night and has the need to talk to a human being that, again, did something else into my brain. And because I wanted to be the best doctor I can be, I started to do some more research. How can I help women? I saw women coming to deliver their baby. They had other worries. So it was not really the pain. Of course, the pain is there, but some had other traumas, or they had anxiety in pregnancy. Everything was doing well, but they thought every day that their baby is going to die. And I really didn't want them to feel that pain in their soul. That was something that really marked me. These were mostly young women with no other illnesses, but this mental issue. It's a difference when you have an elderly woman with cancer. You can understand why she's being afraid. But why is a 20-year-old woman with no other problems pregnant? She should be enjoying this. This is the most beautiful moments in a woman's life. And I have patients who were like 9 months stress. What if my baby dies? And it's a shame.
Yes.
So for me, it was like a journey as a doctor. And I realized I don't want to do what other doctors are doing. Patient comes, she has pain, she gets a pill. Patient comes, she has conflicts, she gets an antidepressant, even worse. She gets a pill to just knock her out. I realized that if you work with people here, then you can change their lives forever. Not an ibuprofen one day, but you work a little bit more and then you change these lives forever. So actually, this is my why and why I'm doing this, because I've been through this as a patient myself. No doctor paid attention to my psychological problems. No doctor paid attention to my anxiety, to my panic attacks when I was growing up. They all thought I had some, pain because I'm a woman, I have menstrual cramps, but actually I was growing through some mental issues, anxiety because of stress with the boyfriend or at university. And I realized that I didn't need pills all of this time. All I really needed was a little bit of chat and a heart-to-heart chat with somebody who is a specialist, because a doctor should also be a specialist in mental health. And I was disappointed that a lot of my colleagues are just doing what is written in the book, giving the pill, sending the patient away, and then another patient comes. I didn't want that. I wanted to make a huge impact on women. So this is my why. I want to treat people and women how I want to be treated. I want the doctor to take care of my body, my mind, and my soul, so I feel complete, happy, and healthy.
Exactly, exactly. And thanks for describing it so well, your why. And this is why I think instinctively when we met first online, I got attracted to you and I wanted to be in touch with you and wanted to know more about you and your work. Because yes, women, and not just women, even men, but this is the subject, women here, we want to be treated, not just the pain, but we want our mind, our spirit to be heard, to and listened to. And many times we're just taking pills, and I'm speaking from experience because I've suffered from endometriosis for a long time in my life. And yes, I needed the medication and the surgery, but it didn't heal completely. It's only when I realized, and I realized myself because I went on my own personal and growth and spiritual journey, that I can heal myself with other tools, mentally, emotionally, and spiritually. And I realized that I have the power within to heal myself. And when I reconnected with my body, when I really reconnected with my body and started to really love myself, I really healed and I freed myself from endometriosis. Whilst I know there are many women who feel that they have to suffer all their life with this condition, I know that it doesn't need to be that way. We can manage pain naturally, and with obviously going to show us something new today. And also by doing the inner work with coaching, mental health, and many other techniques, we can actually free ourselves. And this is the message I want to get out there today. And I thought you are the best person to do it because you are a medical doctor, but you are also a holistic health practitioner. And you've really said what really it is about. And it is about this, yes. And as I said, many of us women suffer silently in pain. When you mentioned having women at 2 a.m. visiting you in hospital, I just got flashbacks of like 20 years ago, or a bit less than 20 years ago, when I used to rush to hospital at any hour, day and night, to get to do something about the pain because it was unbearable. So yeah, I can feel so much for these women you are talking about, because it's not a nice place to be, and you just feel like you're just one of the many. You're just given, I used to be given injections for the pain, blah, prescriptions, take these medicines every blah, 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 and that's it. And it was killing me inside of me, because I knew that is not the life that I was supposed to live instinctively. So I truly admire you, and I really want women to start understanding that they can do something about these situations, health issues, pain that we come across sometimes in our life. So okay. So I'm assuming, like from my own story, that women take medicine, but the pain still remains. And of course, I see out there, they take medicine, painkillers, and the pain still remains. How do you approach it?
First of all, Catherine, thank you very much for sharing your story, because I think a lot of other women will relate to that. They think that I'm the only one who has this pain, nobody understands me, and then I'd rather shut up and, just hide in a corner and live with my pain.
Yes.
I've heard this from women with who I do therapy. I also think that they have, let's talk about mental health. They have this mindset. I am alone. Nobody can help me. I will be alone in my pain. Of course, they take medicine. Maybe it helps. Maybe it doesn't. Then they go to the doctor and they get another unhealthy mindset. I have colleagues who tell the patients, and of course, so we are learning this, endometriosis cannot be healed. Yes. You will have pain all of your life. Yes. So when somebody hears that, I will have pain all of my life. It doesn't matter what I do. You take medicine, it may help, it may not. You may have problems conceiving. So this woman gets all of this negativity into her head, and this just blocks the body. And then she will become anxious, and in the the unconscious mind, will work
Yes.
every time she has pain. When she thinks, I want to get pregnant, the unconscious mind will tell the body, you cannot get pregnant because you have endometriosis. So what I'm doing with a lot of women, I use my stop and go method, is actually to go to the core of the problem and help them again to reconnect with their body, with their soul, with their mind, so it all aligns. And a lot of them, then they have this freedom. I know you do also chakra work, and we're trying also to activate the second chakra, so they have, for example, children.
Yes.
Therefore, I do believe that when I'm working with patients who have chronic pain, especially with women with endometriosis, because it affects 1 in 5 women, and a lot of them do not get diagnosed at fast. They have to go through pain 5 years before they get the diagnostic. I do believe it's important to have the awareness of the pain. So with my program, I address every type of pain, because I do believe that a lot of the pain, sometimes even maybe 90% of the intensity of the pain, doesn't come from the organic pain, but it comes from your mind. And let me do like a small exercise with you. I do this with my clients, and then they realize how powerful our mind is. So we all know we're walking on the street, right? We're minding our own business. We're happy. And at one point, a dog comes and runs at us, from another yard and just yells, it barks. And you make this reaction and you go a little bit like 2 meters away. You're frightened. But then you're like, okay, the dog is there, it has this fence. It cannot do anything to me. So we're starting to think about it. And then we walk away. And then slowly the intensity, just leaves. We're not afraid anymore because we know nothing can happen. But how are you going to react when you know the dog will be there? Yes. You are 10 meters away from that house. You know that dog is going to come. You just visualize that dog. It's barking. It's evil. It wants to come out and destroy you and bite you. And you're walking like this. And then you see the dog and you are living it. You're living it intensely. So you're not thinking anymore. You're not thinking the dog cannot do anything. Because, of course, it's either, the dog is not going to do anything. But you come with these emotions already. And when the dog comes, then, of course, you feel it even more. And then you dissociate. You live with the fear even longer after that. Yes. So if the pain comes like this, it will go fast. But if you really live with it, if you really get anxious, then it's going to be awful. And this is what I saw with patients with endometriosis. I had one with chronic endometriosis, fertility problems over years. So the woman was mentally over. She cried, she screamed, she wouldn't let me touch her and give her the medicine. And she screamed, you're not doing anything for me, you're not helping me. But I couldn't get the IV in because she had the pain. Of course, she was on her period, but her anxiety took over her and we couldn't control her and help her at that point. So the most of the pain, the intensity, the fear, it's a lot in our heads. And this is what I'm helping the woman to disconnect a little bit from that pain and to connect just with the mind and see how the body is working rather than what is she feeling, and to be rational about this. And I can work with this, of course, outside of the pain. So not when they're having the pain, because the clients do not call me, I have the pain now, let's do the exercise now. But we're learning this exercise. So when the pain comes, then they have it. Usually they get the script, they read a little bit, and they do the meditation. And a lot of them, they tell it every time it gets better, to a point when they don't do the meditation anymore because the pain is not that bad. So they're just living with the pain. It's there because it's endometriosis is something from the body. But of course, then we can talk about other treatments that work on the problem. But what I want for them is to get rid of the pain that is inside their head.
Exactly. And maybe also the negative talk that, I can never be better. My pain can only get worse, which will make the pain even more worse. So I think, I think the mind has really a very important part to play. In fact, I think you probably be working with techniques to calm the amygdala, isn't it? To calm the fear, the fear part of the brain, let's say.
Yeah, we can have a lot of approaches. It depends how the client is, because some of them, because I'm a doctor, they said, okay, we want to do this through therapy, so it's just therapy. Others just want also alternative medicine. And then, of course, you can work a lot with aromatherapy. You can work with essential oils when you're doing this, because when it's everything, it's mental. I want to stimulate all of the other senses, but give them like a positive stimulus. And of course, when you're working with lavender, for example, or with sage, your brain, your nose is directly connected to your brain.
Yes.
And then
yes.
It will work even better. Some other want to drink tea out of plants. There's also like a phytoestrogen therapy that I'm recommended to some clients. So you can do a lot of other alternative medicine to treat chronic pain in a lot of illnesses. It depends now what sort of patients you're working with. That's why, of course, I'm a doctor. I'm going to do my anamnesis at first, and I'm going to ask questions and see directly what the best treatment for this patient is. And because, of course, a woman with cancer, I'm not going to, I cannot do this as a doctor. And my belief is a woman with cancer, I'm not going to treat her with essential oils, but I can complement her therapy and help her psychologically to add quality to her life, because quantity maybe you cannot add at such a diagnosis, but you can reduce her anxiety. You can make her live the last months with this joy. And that is most important, to
Exactly.
not be stressed, just to get the patient and really help her with her soul at that point. When the body, let's say, has failed, then we can help the soul, because the soul will live on. The soul has to be happy at the end.
Of course, and this is, I think, when we treat the person from the soul, I think we're giving healing and at a very deep level. Maybe the body's ready to go, because we have to accept that sometimes the body is ready to go, but the body is going, the actual physical body is going with a happy soul. And they will actually be happy to go, because they know it's their time to go, and the soul lives on, as we say. So what you're doing is fantastic, because you are giving the last few months, days, whatever, you're giving them a reason to live, basically, in the last few months of their life, which is totally amazing.
Yeah, like I said, I know I want the same treatment, so this is what I'm giving them, to that person who will listen to them and who will cater to their needs. A lot of the time, these people don't know what they need, because it's a shock. Like, for example, also chronic pain after years. I have a lot of clients who come and say, I've tried years of therapy. I don't have anything. So let's try this. And I say, what would you like? She says, I don't care. Just do something. She's like, whatever, voodoo or what, you do it, and let's see if it works. So at this point, they're definitely they're gonna do anything. So they're very open. I am very happy when I work with them, because they're very open to try anything. Like I said, even essential oils, aromatherapy, and all of these meditations that I'm doing, they're going to do it. And I really love working with them and seeing how they are responding. And then when they write me, I tried this and this and this, and even other therapies that they're doing, it's very, for me, it warms my heart, because it's something that I wanted to do. I wanted to help people, and look, I'm doing it. Yeah, it's amazing how this work is transforming people's lives.
Yes, and this is the most important thing, that's true pain, because probably most people are coming to see you through pain and difficult women's issues. You are helping them to transform their life. So the pain that is transforming their life. And I think when you see it from that way, it is really something beautiful, that you can help women. to change their life and start seeing their life from total different perspective. And for example, you have mentioned before also the idea, the belief that if you suffer from endometriosis for a long period of time, you cannot have children. There is that, you're infertile. I can say I suffered from endometriosis a long time, and after I healed myself, I had my first child at 40. And did I have fertility issues? No, I got pregnant like I wasn't even expecting to get pregnant.
Yeah.
So because I healed myself, and maybe I can share with you, and you can maybe comment on what I've did. I've helped on healing my body physically with, for example, reflexology. I've used essential oils. I've used Reiki. I've used obviously chakra dance and sacral chakra work. I've learned to accept and love myself, because I had before suffered from eating disorder. Maybe even you can speak maybe about the connection of people of having eating disorders, and then they find out to have many different women's health issues, not endometriosis only, how it can that affect women's health, because of course that has affected my health as a woman. So once I've started clearing my own issues, my own limiting beliefs, my relationship with myself as a woman, and I was practicing meditation, yoga, and doing all the woo-woo stuff that you can even imagine. I've healed myself, and not just I healed myself, but I got pregnant very easily at the age of 39, and I had my first child a week after I was 40.
Yay! That is like an amazing story, definitely. I just love your story.
Amazing. And this is why I'm so passionate about giving hope to women that you can heal from any woman's health issue. And also, even if doctor says, you have this infertility problem, never give up. Just do the things that are good for you, and then things will happen naturally. And maybe you can add something to this, how you help women in this, in this situation, what you do with women in this situation.
Yeah, definitely. Infertility is another reason why women reach out to me. Like, it's incredible. Even women who are 25, and you think, she's young, she shouldn't be having these problems, but then she went to so many doctors, and they've tried so many things, and of course, like I said, they're done. They want like a miracle, and that's why they're Googling for alternative medicine. And I am happy that they're doing this, because you can do anything, till you're, I don't know, till you're in your menopause at 50. You can do it. You just have to work with different aspects. And you've mentioned something that I actually use in my therapy for infertility. It's releasing and this limiting beliefs that women have. And we talked about them. For example, with endometriosis, is this thing, you will never be able to have children, or you will have children with difficulty, something like this. A thought that is running not only in their minds, it's provoking pain in their soul, it's provoking pain in their body, and it's provoking dysfunction in their body. So even a thought will ruin your chances of getting pregnant. So I do talk to them and see if they have these limiting beliefs, to see if we can work on them. And I'm also a practitioner for theta healing. This is very a great method to release this limiting beliefs. I really love it with women, because we can do it very easily online, and it's very, very powerful. After we've talked about the limiting beliefs, I do approach this nutrition aspect, which a lot of doctors don't talk about. They see the patient, they see that the patient is very thin, they see if the patient is obese, and a lot of them do not approach nutrition. And I'm like, you can see, you have your sight, you see the patient, and usually I don't even have to talk a lot with her. I just see her, and then I can deduce why is she having issues. Because if you are very thin, or if you have weight issues, if you are obese, these are also factors that contribute to infertility. So I would say doctors recommend, okay, women who are thin, you should gain more weight, and women who have too much, maybe they should lose. But then I have another approach, because to tell a woman, okay, you're fat, and that's why you cannot have babies, that's again a no-go. You cannot do that, because it is untrue, right? It is untrue. I've had a lot of examples with women who are extremely obese, who have a lot of children, and they're happy. So of course there's always exceptions to the rules. For me, what's important is nutrition. What are these women eating? Because you can get fat if you just eat chocolate, but that is not going to resolve your issues. Or you can lose weight, but all you eat is kale. So you lose 20 pounds, but then you cannot walk anymore because you don't have any energy. So that's why my approach is to be very gentle to the woman, to teach her to be gentle to herself, to be gentle to her body, because her body is going to produce children, and you cannot beat your body up. You have to make the baby right now. This is never going to work.
So true.
Definitely. And because of this, I did a lot of research. I Googled Medscape, all of these international articles on supplements to see which are the best supplements. And then when I read an article, it was quite recently, and then I met other women through our women network who were in this business. I wished for it. I thought I need help with this. I want to work with something special. And then I met this woman who introduced me to some products. And then I was like, this is exactly what I was looking for.
Wow.
Because I found, people say the pregnant women should eat these supplements, but a lot of them, they don't need to, because they eat it with their normal food. What they need is specific supplements, what they usually don't get in their diet. And for example, of course, there are many aspects that I can talk about, but one of them is fat. You're going to hear everywhere, fat is bad for you. Don't eat fat. If you eat fat, you will be fat. And that is so untrue. We just have to eat the good fat. Yes. Because everybody knows it. Water is important for the body, right? 70% of our body is water. But did you know that in all of our cells, there is a lot of fat, and good fat is what we need? Our skin is made out of so many cells, and all of our cells have a fat coat. So when you think about it, what is it how do you feel when you go outside, it's very cold, and you have a very bad coat on you? You have, it's ripped, it's poor quality. How do you feel? And how do you feel when you go outside and you have a really new jacket and you have the padding on and you are really enjoying yourself? This is exactly what our cells need. Our cells need good fat. And I tell you, women who are eating chips, right? Who are eating fast food, they don't get the good fat. They only get the bad fat, who is going to add pounds, of course. But then you're not giving anything of quality to your cells. And which is our most important cell when we're talking about fertility? The egg. And the egg needs this. That's why they don't have an ovulation, because you're not giving the good things. That's why they have hormonal issues, because estrogen and progesterone are hormones who are from fat. We have other hormones who are from protein. But these hormones, these women hormones, these are made from fat. So we do need good fat in our bodies, right? So ladies, no diet, okay? Don't eat just water and lemon. It's not going to help you. You need a healthy diet.
So this is very interesting, because so many of us women want to have the perfect figure, how the media out there makes us think is the perfect figure. But and I can say it from experience, because I had an eating disorder. I had this perfect figure in my head, which was totally messed up. But anyway, most of us want to have this perfect model figure, like on the magazine. But that's not reality. And that's probably not actually good for our body if we want to have children.
No.
Even if we don't want to have children, it's not good, because it's harming our body, because our body is not made to live, as you said, with lemon and water. But if we want to have children, it's something even more we have to really think about.
Yeah, and it's having a healthy body is important also for women who don't want to have children, just like you said, because what are these women going to have? Like menstrual problems. They're going to have pain, or they're going to have problems with bleeding, and they're going to have ovarian cysts. So even though they don't want to have children, so infertility, it's like off the table. It's not a discussion. They don't even care about that. But they're going to have other issues. And again, a lot of women who go to the gynecologist come because they have hormonal issues, because there's menstrual cycles is not 28 days, it's like 40 or it's 10, and then they bleed again. It's huge. Like when I did my Romanian group, and they could post questions, and I answered them. I answered over 10,000 questions for free for my Romanian group. Most of the questions, I think half of them, were because the menstrual cycle was not okay. So it's a huge deal, and we can treat it not just with the pill. You go to the doctor, you have menstrual problems, we will regulate it with the pill, and okay, but maybe not every woman wants to have this chemicals in her body. Maybe she wants another advice, but it is easier, and it's cost effective, and it's 1 minute to tell the woman, here is the receipt for the pill, buy. I don't know how many doctors are going to say, okay, let's talk. What are your issues? I see you are a little bit, too much or too little. A lot of doctors do not diagnose anorexia, or bulimia. They don't recognize that. The woman comes, she has problems with her menstruation. The doctor doesn't ask 2 or 3 questions and gives her the pill. And then she goes, and then she throws up, or she doesn't eat anything. So I do believe that this is awful, how modern medicine is practiced at the time. That's why we need more doctors doing alternative medicine, showing this extra interest. And actually, this is my big vision, that I'm going to help more doctors be aware that they can do even more for their patient, and they can help their patient, that their patients are going to come, and they're not going to say, okay, you helped me with my menstrual problems. They're going to tell them, you saved my life, you changed my life. And it doesn't have to be a life and death situation, like a huge operation or whatever. Just this, and you've changed that person's life. And for me, it's like amazing. I don't have to help a woman have a baby, that is a huge deal. But some of them have like years suffering and struggling with these menstrual issues, and then you help her change her diet a little bit, and then all of these problems goes away, and she thanks you because she can live a life without the stress. So
and it's very stressful. I mean, I lived it, and it's very stressful. And I used to certain periods of the month, I used to dread them, hate them, literally hate them, and hate in a way being a woman. So that was actually another problem that I created, hate being a woman. But when I've really worked through the issues that were affecting me, I've resolved completely, and I've realized that I can be totally free even during my menstrual cycle, because I can live a completely normal life, whatever that means, and do whatever I want, enjoy my life pain free, and that transformed my life, because I felt like a new woman.
Yeah, Catherine, you said an amazing thing. That is something that I also hear from women. I hate being a woman. There are the women who, because of infertility or because of these problems with bleeding, they just don't feel okay in their bodies. And how awful is that you don't connect with your body? This is the vessel of your soul. You have to love everything. And this is why I integrated this stop and go method. So the women who are all in their head, I hate myself, I hate my body, I'm fat, I'm thin, I can have babies. I'm trying to get them out of their head, literally, so we can balance the three elements. You know, the body, the mind, and the soul, which are three different entities, and you really have to balance them separately, so they can come together, and then we will have a woman who is happy with everything about her, right? With how she reacts with emotions, how she sees herself. And of course, I do believe that the mind can heal us. A lot of our problems can be healed if we heal our mind and our soul.
Yes.
And I can detail my method a little bit for everybody.
Maybe you can give us a bit of you walk us through very briefly, or anything you want to do about this stop and go technique. You tell us what it is about, because I'm very curious about it, and how it helps, and we can see how it helps us to reconnect with our body and reduce the pain and the issues that we have as women. So yes, please go ahead.
Yeah, definitely. Of course, when I'm working with a client, it's a guided method, and then I know a lot of her special needs and special special things that she has. But I do believe that if the people maybe make notes, and then they try to see, okay, maybe I can use this on myself, because a lot of the time you don't need that much help. It depends how the problem is, how strong the problem is. So I've said it before. For me, what is important is that you stop and think, because when you have pain, you're not thinking. You have pain, and then you think this is the worst thing that has ever happened to you. So I love to dissociate. I love to help clients dissociate from the pain. That's why the first step is just stop. Stop, get out of your head. And then the second step is listen to your pain. Where is the pain? Because what do patients say when they're in the hospital? I have pain. And then what do we ask? Where do you have pain? So this is something that the client can do on her own. Like the unspecific, where do you have pain? Okay, the pain is in the belly. Good. Then I want the client to recognize the pain, to see exactly where the pain is in the body. So so the patient can be specific about the pain. I have it in my lower abdomen, it's right, or it's in the middle, or it's left. I encourage them even to put the hands directly on the area, because as a doctor, I know what organs they are there. So when they're really touching themselves, like I really want the women to touch their bodies. So this is the first step of connecting with them, to really feel. And then really think about it. So they're really, okay, it's actually there. Yeah, okay, but where? To really find that little spot where it hurts. Of course, she might say other characteristic, if it's a stabbing pain, if it comes and goes, depending on the problem, we will focus exactly on that. For, let's say, menstrual cramps, it comes and goes, right? And endometriosis is going to be like a horrible pain that is just there, because it's internal bleeding, and the patient will have pain, or even women with migraines or any other pain in their body. And then we start talking about the pain. I do ask, the fourth step is digest, is why do you think you have the pain right now? Really think about it. Really be aware of your pain. Is it a normal pain? Is it recurring pain? Okay, yeah, it's my menstrual pain. Okay, so menstrual pain, then it's normal to have menstrual pain. It's normal to have pain during the menstruation. And they're like, yeah, okay, I guess so. I mean, a lot of women have it. Okay, so it's not that bad. So the first thing is to realize, okay, where do I have the pain, and why do I have it? And is it a normal pain? And then they have to accept the pain.
Yes.
Of course, it's just like in delivery. Women ask me, why is it so painful? And I'm like, you're giving birth to a baby. I think it's a little bit late to explain to you why you have pain. Yeah, it's part of the process. So yeah, accept the fact. And women who who have training and know that during the birth it's going to be painful like hell, they are like so great under delivery. Between the pauses, they talk to you and they laugh. And when the pain comes, they're like, I need a break. And then, they go through the pain. When the pain goes, then they go back to normal. And this is exactly with any other type of pain. When you've acknowledged it, you realized it, and you've made peace with your body. Why, a lot of women say, I hate my uterus. Why are you hating your uterus? It's part of you. You love your uterus. The poor uterus has pain because you're bleeding and you need contractions, and just it's something normal to you. It's your body, so love the pain that your uterus is giving you. So after the woman consciously accept the fact that the pain is normal, then she will start to heal, and we can do more sessions. I also do theta healing, which I give her the healing energy, and Reiki is the same thing. So it depends on the client. You can use other methods to increase this healing process. And then the 7th step is start, live, because the woman has understood, and now she can live with the pain. It's exactly like you said. You need quality, because if you're stuck with the pain, you make pain a big part of your life. It's something that you carry with you all day long, and it's exhausting. But once you've accepted it, that it's there, then you're not going to be anxious anymore, and then you're going to live and do other things. Like you said, after you healed yourself, you could suddenly do everything and live your life the way you wanted to.
Exactly. And sometimes, when I get the odd month where, I feel I'm getting some pain, I don't even need to take medicine. But I realize sometimes, because something we women fail to do is we think that we're superwoman and we need to do everything. But now I've learned, maybe because I'm becoming older and wiser, that during maybe these 4 or 5 days of the month, my body needs to rest, and I need to be more gentle, and I need to give it more love. So instead of trying to put in my schedule so many things, I say, okay, I'm just going to leave my schedule as free as possible. So I give my body some deserved rest, because this is part of a woman's cycle, and and that part of the cycle needs rest. Yeah. So, and I think this is very tough for so many women, because nowadays in the modern world, we're so programmed that we have to do all the time.
Yeah, definitely. I love what you brought up, because I, for example, for me, I get a little bit mean, so that's a sign that I should be taking a break. But then when I realize that, it's because that time of the month is coming, then I don't feel bad that I'm mean, and I'm letting my husband know, I may be a little bit overreacting, but so that and now he's so trained, he knows exactly. When I'm really being mean to him, he's like, it's okay, in a couple of days you'll be good. So he doesn't take me seriously anymore. But then I work with oils. I love it during these menstrual cramps, and I put my aromatherapy and my roll-ons, and I'm doing meditation, and I am I've been doing this for a year now, so not a lot of time, and I'm so amazed. I've reduced my ibuprofen. I used to have migraines and pain, and I don't know how many pills, I think 10 or 15 a month of ibuprofen. And now maybe I'm doing it once a month. I don't know. Maybe I think maybe once a month when the pain, my headache is so powerful that I've tried everything and it doesn't work.
Yes.
And it was amazing what it's done for me and my husband, because he has the same situation. It's usually also a lot of psychosomatic. So working with my mind has healed also my headaches, and has definitely reduced also the pain that is association with menstrual cramps. Definitely working with this alternative medicine, it's been incredible. And then your stomach doesn't suffer anymore. You don't. Yeah.
Of course, and this is this. We have also to realize that when we are taking so many different medicines, we are causing side effects, and in the stomach, even bones. Some medicine that is given for example, endometriosis causes some problems with the bone and the osteoporosis. And some of them can also cause breast tumors, I think, as well, if I remember correctly.
Yeah,
some of the hormone pills. So we have to really evaluate: do I really want to take a pill to shut down the pain, or maybe I should investigate another way to treat me holistically, so I don't cause other problems in my other areas of my body.
Yeah, definitely.
When I've suggested the pills, I've always told them, no, I'm sorry, because I know the side effects and I don't go that way. And the doctors, most of the doctors are not like you. You're a brilliant star. Tell you, no, but the side effects are only percentage. But I don't want to take the risk. If there's another way, I will go to the other way. And I think also we women in general need to be educated that it's not as soon as we feel pain we pop a pill. Because as you are saying, you are a doctor, a qualified medical doctor, and you are showing women another way of being, of managing their pain and transforming their lives.
Yeah, and I really love that you are supporting this, that women shouldn't be taking that many medicine. And I totally agree. I step away. I'm telling women there are definitely other ways that you can heal yourself, because usually, for example, more often than not, young women who come with pain, I think it's 90% psychosomatic. It has nothing to do with the body. It has like 90% to do with the mind, because they're having stress at work, they're having anxiety. All of this leads to abdominal pain in women, and it is a fact. This is science. You can talk to a psychiatrist, a psychologist. They will tell you that. But I don't know why other doctors don't know this. And I'm like, we learned this in school, but I think it was one lesson, and a lot of people just slept through it. And they're giving pills because you have headache, you get this pill. You have pain here, you get this pill. You have pain there. I'm like, a lot of the women, the young women, are healthy. There's nothing wrong with them, but they are emotional. Our emotions will create a lot of disturbances in our body, like IBS, irritable bowel syndrome. This is all due stress. It has nothing to do. And these women, because I know I've had it when I was 18 and I had my big exam. It was awful for me. And it had nothing to do with my bowel. It was just the fact that I was stressed. So if somebody had made a little bit of therapy with me and said, you're just stressed. And I had one doctor who said it might not be my bowel. It might be stress. One. And I was 18 and I was facing an exam. And I saw 3 doctors. Only one of them said, you may be stressed. It was a wow moment for me. And that is actually like the first one who really listened to me. I have so much respect for the doctor in Romania. Like I said, one from other 2 gastroenterologists. So, internal medicine, and other 3 gynecologists. So I've had 6 doctors, and only one of them said it might be because of stress. So we shouldn't be treating the women with the pill, with the baby pill, with estrogen, because we should be investing more, and maybe the state should be doing this. They should be investing more in mental health, because we know our youth are struggling with anxiety and with depression, and this will all lead to other pains in our body. So then we need more therapy and more education, and less medicine, and less pills.
Exactly. In fact, even now that I consider myself healed completely from endometriosis, but because what's been going on and some personal stuff that I had been through, and there were a couple of months that I felt pain, and more pain, that I said, I'm really concerned. But then I took a step back, as you said, maybe I stopped from thinking,
Stop.
but no, this is not it. There's so much going on that my body is responding to the stress, to what's going on, to the energy around me, and it's going in my probably weakest area, isn't it? It goes in the womb. So when I realized that, and I've decided to rest instead of work and keep going and going, it went down. It subsided on its own. So yes, stress can cause so much issues for women, especially as you know, emotions are directly related. They go into the womb.
For women, definitely. Yes, we feel with our hearts and with our womb. Definitely, it's a connection.
Exactly. So it's obvious, isn't it? It's going to cause us problem in that area of the body.
Yeah, it is our feminine. It's our most feminine part. So definitely, if women who are not imbalanced, they are more prone. Like stress is really related to cancer. So that's why now we're saying, specialists are saying everywhere, we have to reduce stress. This will prevent a lot of disease, like heart disease and cancer disease. Definitely try to reduce stress, and mental health is becoming, back in the day, if you went to a psychiatrist, you were crazy, but now it's getting to be normalized, especially in the States. That is like since years, they're doing this normal. This is very normal to get rid of stress. And like I said before, a lot of nutritionists are now changing the way they are advising their clients, not just you have to lose weight very fast or that. They're really focusing on quality foods, on more quality and not the quantity of kilos that they lose, because once your body is in balance, you will start to lose weight without even trying, because you, like I said, your cells are going to be normal. They're going to have more power, that good fat is going to work, and then your cells are going to be more vivid. And that's why I do believe that nutrition is also the way, or like mental health practices really change the nutrition. And now that I'm talking about the nutrition, I wanted to invite you, Catherine, and all of the people watching. We're going to do another live event next week, actually, with two amazing women. And when we're going to be talking about nutrition, I have made tried this treatment plan for over a year, and I want you to profit from her story because it's amazing. She's been through a lot of the stuff that I've been through emotionally and mentally, and she is such an inspiration to me and has really helped me a lot during the months that I've known her. And also with Catherine, who's also a specialist when it comes to this sort of treatments. And then we will be talking about oils, about essential oils, and then we were going to be talking about balancing oils. And I do believe that this is something that a lot of doctors don't put focus on. Just like I said, they just tell you, you should be losing weight, do more sports, and don't eat chips. And that is wrong. Studies have shown sports are not going to help you lose weight. Sport is going to make you fit, like cardio, it's good for your heart, of course, for your knees, but it doesn't really do a lot for your fat if you don't do also a diet, if you don't change the way that you eat, if you keep eating.
So maybe after we conclude the interview, you can post in the live also the link for the next week's event, so we all have it available and we can plan it and join. I really look forward to this because I love essential oils. I have my kit of essential oils and I use them. Yes, I'm not trained, but my personal interest, I use them for me and for my family. I have them running around everywhere. So I really do believe in the power of essential oils. They come from nature. So there's nothing better than nature. So yes, and I'm so happy that you use essential oils within your practice as a doctor, gynecologist, because I think women need also to hear that. And it's so feminine, isn't it? Essential oils. It's
and they smell so lovely. You know, women, we like to smell pretty. So
Yeah.
it is amazing what you do when you use them, and then your whole body reacts to that. You just
Exactly.
feel good, and yeah, you want that. You want to be calm. You want to be at peace, and like really get in touch with yourself. A lot of meditation. I will be talking a lot of from my experience, and of course from May's experience, because I do believe that a lot of people who have never heard about this sort of nutrition, okay, what should I be, you know, changing in my diet, they're going to recognize themselves, and maybe they'll realize, aha, so maybe that's what I'm missing from all of the strategies that I've tried, from 10,000 diets that I've tried, and no, but nothing worked. Or more often, you know, they have the rebound effect, and then they gain
Yes.
more weight, and then they're happy and even more depressed. So I do believe in really giving the best alternatives for the clients, for our patients, so they have a balanced life and a healthy life, and also be happy mentally. I do believe that is truly important. So if anybody else is interested in having this discussion and hearing the discussion, we will be posting it online. But maybe you want to make a note of it. I will be definitely giving you the link, and even make a poster for the presentation. And if anybody else who is listening to this now live or later in the replays, you can contact me anytime. And this is the website. This is under my name, femindipity.com, or this is
Exactly.
yourpotential.com. And you can contact me, and we can see if we can work together, if I am the right person to help you with your issues. Because of course, everybody's a specialist in their own way, and everybody is interested. Like, I'm also interested in giving you the best treatment. So if I can help you, I will give anything. You know, I give all my knowledge. Like, every day I'm learning something new, so I can be there for me. I'm my first patient, and
Yes.
then for all the other amazing women who deserve to be healthy and happy throughout their lives.
Exactly. And I think as women, we must make it a priority to be healthy and happy. I think that is our priority, because as women, we have lots of responsibilities, you know, and if we are healthy and happy, then everyone around us will be happy and healthy. So it's really, really important. So anyone who is interested and maybe suffering from any woman health issues, we spoke about endometriosis, fertility, and you would like Dr. Laura to help you to transform your life and live a much better life, and so you can discuss an individualized program with her, because we are all different. Do feel free to contact her on her website, femindipity.com. This is yourpotential.com. And do you have a Facebook page, maybe? Because since we're on Facebook, it's good to mention Facebook as well.
Yeah, definitely. You can also find the links on the website, or I think you tagged me to this. So my personal account is Laura S. Gotz. Right there. I think if they're friends with you, they're going to find me. So I do believe that you are very easily to be. I am also very easily to be found. And just in case I don't see your message, because I get a lot of friends requests, is always better just to get on the website and have the contact. So you email me directly, and then the email will be there, and then I will read it. And I am very, very happy to have more chats with people and see how I can turn their lives and transform. Even if it's a health issue, or even a mental issue, or something with the pregnancy, if they have anxiety, then we can work through this. So at the end, they're, like I said, happy and healthy.
Exactly. So thank you so much. I'm so happy that we have done this, and I'm so grateful, because I share the same beliefs as you. I'm very passionate about treating our health with natural medicine, and basically treating our bodies as a sacred, something very sacred, and giving it the best. And you are doing this. So I support women who treat woman's body as something very sacred, and to be treated with respect. And I honor you because you are doing this. And keep following Laura, keep following me, and you can see what we are up to. And if you're interested, you can work with us on your health, on your happiness. And who knows, why we might get more together in the future to help, to support women in living a healthy and happy life. So last words from you, Laura, and we can say goodbye, good night.
Thank you very much for the invitation, Catherine. Together we made something beautiful, and I am so happy every time other coaches invite me, so we can share, because it's not about me or it's not about you. It's like two women who are genuinely interested in helping other women and sharing from their experiences, because we wouldn't be sharing if we hadn't been in that dark place, you know, in our lives. And then when we got out, we were like, I want to tell other women about this. You know, why haven't other women helped me till now? And then I had to figure that out on my own. And now we have this chance to help women to like not get into that dark place, just to be happy and healthy and have less stress. So I'm very, very honored to be here. Thank you very much again. And I'm wishing all women to be true to themselves and to honor their bodies, and to start today, you know, ask themselves, do I love myself, and why don't I? And actually, there is no reason why don't I, because you have to love yourself. You love yourself. But if something comes up, I don't love myself because, just try to erase that thought. Just try to erase that thought, because it's a lie. It's a lie that somebody else, like magazines, have told you. For example, you know, all of these magazines with very thin women. These are all lies. Women are beautiful. Women are amazing from body, mind, and soul. And they should see that. And I promise you 100%, this is what I do when I have clients for my transformational program. You are not going to believe how much freedom you will have, how much freedom you will feel, how light you will feel the moment you truly love yourself. Learn to love yourself. That is the most important thing, because it goes from there. And then you can do whatever you want.
I can definitely agree with you, because once we start loving ourselves and loving ourselves inside out, you know, loving our body as it is, and, you know, accepting each part of our body, and we can truly feel free, and we can truly feel the joy and the excitement. And you also, part of being a woman is to feel sensual. And I think it is amazing that, you know, once you discover that and you feel free to allow yourself to explore your sensuality and express it, it is really amazing, and it transforms your life. And I think all women need to embrace sensuality as part of who they are, not, you know, what people have told us that to be sensual you need to be this way, as you said, the magazines. So let's enjoy being women.
That's another theme for another live, Catherine. So definitely.
Enjoying being a woman, definitely, because it's very healing, very, very healing and powerful. So thanks once again, Laura. Thanks for all of you watching. It will be available, the replay, on my Facebook page, and Laura will share it, and we will share it far and wide, so we get the message across wherever we can. So thank you so much, and have a lovely evening. And enjoy being a woman.
Enjoy being a woman. Amazing advice. Okay. Thank you, Catherine.